Hello everyone, today we will be discussing a new topic on oral surgery, that is impaction. So first we will discuss about the definition of the impaction. So the word impaction comes from the Latin word impactus, which means an organ or a structure which has become, which because of an abnormal mechanical condition has become has been prevented from assuming its normal position. So at various time, the number of authors have given various definitions for impaction. Like in 1962, Rounds defined impaction as a condition in which a tooth is embedded in the alveolus so that its further erection is prevented. In 1975, Archer defined impaction as a tooth which is completely or partially erupted and is positioned against another tooth or a bone or a soft tissue so that its further eruption is unlikely. Then Andreasen in 1997 defined impaction as a cessation of the eruption of a tooth which is caused by clinically or radiographically detectable physical barrier in the eruption path or by an ectopic position of the tooth. Then later, Peterson defined a tooth which is considered impacted when it has failed to fully erupt into the oral cavity within its expected developmental time period and can no longer reasonably be expected to do so. So as you can see, there are 5 definitions for impaction, and among all these definitions, there are 3 factors or 3 criteria that are constant. First one is that a tooth which is prevented from its eruption into the oral cavity, and it is embedded in the alveolus or the alveolar ridge. Second factor is that there is a physical barrier or mechanical barrier, such as a soft tissue or a bony barrier, or there is another tooth. And third is that there is no expectation that the tooth will further erupt into the oral cavity beyond as the chronological age of the chronological age of the eruption has passed. Okay, so a tooth that has not erupted into the oral cavity beyond its chronological age, and that particular tooth is not expected to even erupt into the oral cavity in further time. So that is how we define impaction. So about the tooth eruption is defined as the movement of the tooth from its site of development within the alveolar bone to its functional position in the oral cavity. You can see in this picture that the tooth bud develops below and it erupts into oral cavity in due course of time. So there are various eruption stages, and there are mechanism for eruption, and there may be various causes which resist the eruption of tooth. The eruption stages are intraosseous stages and mucosal stage and preocclusal stage, occlusal stage, and maturation stage. And amongst the intraosseous stage, mucosal stage, and preocclusal stage, the root formation and bone formation, along with the vascular hydrostatic pressure, are the main factors which facilitate the eruption of the tooth into the oral cavity. And in intraosseous stage, bone and the primary tooth are the main resisting factors that resist the eruption of the tooth in the oral cavity. In mucosal stage, thick mucosa above the erupting bud of the tooth is the factor that resists the eruption of the tooth. And in preocclusal stage, periodontal ligament and masticatory forces resist the eruption of the tooth. In occlusal stage and maturation stage, root elongation and bone formation are the basic factors that facilitate the eruption of the tooth, while periodontal ligament, masticatory force, and occlusion from the arch, from the tooth present on the opposite arch, they resist in the eruption of the tooth. Now, there are 3 terminologies that need to be differentiated and understood well. The first one is impacted tooth, unerupted tooth, and malposed tooth. Impacted tooth is the one that has failed to. Then second term is unerupted tooth. Unerupted tooth is the one that is in the process of eruption and is likely to erupt based on the clinical and radiological findings, and the eruption potential has not been lost. And a malpose tooth is tooth that is unerupted or erupted, which is in abnormal position in the maxilla or mandible. So these are the three terms, that is impacted tooth, unerupted tooth, and malpose tooth. So what are the order or the frequency of impaction? So the first most impacted tooth found in the oral cavity is the mandibular third molar, followed by maxillary third molars, then maxillary canine, mandibular premolars, maxillary premolars, mandibular canines, maxillary central incisors, and maxillary lateral incisors. So these are the various theories of impaction. First one is the orthodontic theory, second is phylogenetic theory, pathological theory, fourth one is Mendelian theory, and fifth one is the endocrinal theory. According to the orthodontic theory, it states that the jaws develop in downward and forward direction, and the growth of the jaw and movement occurs in forward direction. So anything that interferes with the movement will cause an impaction. That is, a small jaw or decreased space will result in the impaction of the third molar, especially third molar, because they are the last to erupt in the oral cavity, so they will not find any space because of the kind of interference in the growth of the jaw, and a dense bone will decrease the movement of the teeth in the forward direction. According to the phylogenetic theory, the nature tries to eliminate the disused organ or the vestigial organ, the most functional masticatory force, better the development of the jaw. So due to So, due to changing nutritional habits, use of large, powerful jaws have been practically eliminated. Thus, over centuries, the mandible and maxilla have decreased in size, leaving insufficient room for the third molars. Then, pathological theory, which states that chronic infections affecting any. So, if there is any pathology present, or if there is any condensation of the bone present due to any disease, then there will be prevention of the eruption of the bone. According to the Mendelian theory, it is the hereditary is the most common cause, and the transmission of small jaws and large teeth from parents to siblings and their progenies will result in insufficient space, and this is the this may be important etiologic factor in occurrence of impaction. Then, according to endocrinological theory, it says that increase or decrease in the growth hormone secretion may affect the size of the jaw. So, smaller the size of the jaw, the greater is the incidence of impaction of the teeth. So, this was the introduction to the impaction of teeth, its theories and definition. Thank you.